splanchnic nerve. They meet at the celiac ganglion, which has contributory fibers that innervate the stomach, the blood vessels of the abdomen, liver, gallbladder, pancreas, adrenal gland, and small intestine. Therefore, any of these organs could be affected. In much of the same way as mentioned before, it can affect these organs. Muscles in this area that could be affected could be the trapezius and the iliocostalis dorsi as it inserts on the ribs. This muscle causes an extension of the spine and bends it to one side. Injury to this muscle would definitely cause a malfunction of the spine. Also, probably the posterior serratus muscle inferior could be affected, affecting the motion of the shoulder blade. Point number 12 occurs at 1 p.m. and is situated right on the spine around L1, first lumbar vertebrae, right at the thoraco-lumbar junction, and is supposed to cause illness and death within 15 years. This is in the area of acupuncture points governing vessels 5 through 7, which are very important points. Governor vessel is right on L1. A blow here could interfere with the flow of qi through the governing vessel channel, also known as the Du Mai, which is one of the main rivers of energy in the body. Biomechanically, this is also one of the more commonly injured areas of the spine. Wherever there is a transition of vertebrae, such as from the cervical spine to the thoracic spine, we see an increased incidence of injury. It is at this point that the thoracic spine ends and the lumbar spine begins. The 12th thoracic vertebrae can have spinal nerves that exit both to the inferior mesenteric ganglion and to the celiac ganglion, affecting all the organs of digestion, elimination, and reproduction. Primarily, the spinal nerves from the 11th thoracic and 12th thoracic exit to the kidneys, ureters, small intestines, and the upper and lower back. Malfunction in any one of these things can easily cause illness. However, because the thoraco-lumbar junction is one of the most fragile, both biomechanically, neurologically, and energetically, the body makes great efforts to try to prevent problems in this area. Consider the fact that the front of the body only has 5 major muscle groups: the pectoralis, the rectus abdominis, and the obliques. The back, in comparison, while covering approximately the same surface area, has approximately 200 pairs of muscle groups. So, biomechanically, the body tries to protect this fragile area by increased musculature. Neurologically, the cross innervations between spinal segments are there to protect minor injuries from causing severe neurological complications. In acupuncture terms, besides the 12 main meridians, the 8 extraordinary vessels have several interesting intersections in this area, such as the belt channel Tai Mo. Point number 13 occurs at 7 p.m. The results are paralysis within 2 weeks. It is at the tip of the 10th rib on the left. The area around the 9th and 10th lower caudal portion of the ribs lies over the caudal portion of the pleura. The pleura is a delicate membrane that surrounds each lung. The portion that curves around the lung is known as the pulmonary pleura. The rest of the membrane lines the inner surface of the chest wall, covers the diaphragm, and is reflected over the structures occupying the middle of the thorax. This lower portion is known as the parietal pleura. These 2 layers of the pleura are continuous with each other below the root of the lung. In a healthy person, these 2 sections of the pleura are in contact with each other, but there is a potential space between them known as the pleural cavity. There are different portions of the parietal pleura. The portion which lines the inner surfaces of the ribs is known as the costal pleura. The sides, the pleura on the left side of the body, go as low as the 10th rib in the front and in the back as low as the 12th rib. The arteries of the pleura are derived from the intercostal, internal thoracic, musculophrenic, thymic, pericardic, pulmonary, and bronchial vessels. The veins correspond to the same arteries. Primarily, the arteries that would be affected with a blow here would be the intercostal and internal thoracic arteries. The nerves affected would be those derived from the phrenic, intercostal, vagus, and sympathetic nerves. Part of the pleura also has other innervations from the vagus and sympathetic nerves through the pulmonary plexuses. However, the part innervated from the pulmonary plexus is a portion of the pleura that is higher up. The sympathetic portion of the autonomic nervous system controls the fight or flight response. The vagus nerve moderates the functioning of the heart and, to an extent, all the viscera in the abdominal cavity. Injuring the vagus nerve can cause malfunction of just about any internal organ. The lymphatic vessels of the pleura consist of two sets, one in the visceral portion and the other in the parietal portion of the membrane. Those of the visceral pleura drain into the superficial efferents of the lung. The lymphatics of the parietal pleura have three areas that they end in. Those of the costal portion join the lymphatics of the internal intercostals. The lymph nodes of the diaphragmatic part are drained by the efferents of the diaphragm, and those of the mediastinal portion terminate in the posterior mediastinal nodes. Primarily, the lymph vessels that would be affected by a blow here would be the costal portion that drain into the sternal lymph nodes. Definitely, a blow here can collapse a lung or cause severe cramping and restriction of motion, which could be a form of paralysis. A blow here could also cause temporary or permanent inability to take a deep breath due to injury to the nerves, the lower portion of the lung, rupture of the pleura, or inflammation of the pleurisy. These things could result in loss of motion along the thorax and rib cage, which in effect would be a form of paralysis. The muscle that would be primarily affected here would be the external oblique. The action of the external oblique is that it bends the ribs and the vertebral column to the side laterally and rotates the thoracic rib cage area downward, bringing the shoulder of the same side forward when only one of the external obliques contract. When both the left and the right external obliques contract at the same time, they flex the vertebral column forward, drawing the pubic bone toward the chest. The external obliques are innervated by the 8th through 12th intercostal nerves and the iliohypogastric and the ilioguinal nerves. Injury to the muscle or the nerve endings of the muscle could result in a partial paralysis of that side of the body. This would probably be temporary in nature. The organs underneath the stomach point would be the inferior tip of the left lung upon full inspiration, the stomach, and the splenic flexure of the large intestine. Beneath the stomach would be the spleen. A deep penetrating force even to the front of the body could injure the spleen, so the same damage could occur to the spleen if the energy was transmitted properly and leave the stomach unscathed. Point number 14 occurs at 8 p.m., which results in a cough, sore throat, increased fever, and illness which would begin in a few days. This appears to be on the right side of the chest at approximately the inner space between the second and third rib where they join to the sternum. The muscles primarily affected would be the pectoralis major, and in between the ribs would be the intercostalis internus. Going more to the inside, we would find the transversus thoracis muscle. The action of the intercostalis internus is to draw the ribs together. The nerves that innervate the internal intercostals are the intercostalis internus, are the intercostal nerves. The transversus thoracis draws the ribs downward, decreasing the thoracic cavity. These muscles are also innervated by branches of the intercostal nerves. Some of the blood vessels running through this area are the internal mammary vessels. This consists of both arteries and veins. These lie in the area between the ribs. Deep penetration could injure the superior vena cava as it descends. The superior vena cava is the major blood vessel that flows into the heart. There are lymphatic vessels and nodes which lie between the ribs that could be affected by a blow in this area. Most of these end in the axillary nodes, meaning that they drain into the armpit. But some of these lymphatic vessels pass to the sternal nodes, which mean they drain towards the center of the chest. A blow here could obstruct lymphatic flow either way. The next point is point number 15. It occurs at 9 p.m. The resulting consequences are supposed to be dizziness, loss of memory, and death within 6 months. It appears to be about 1 inch to 1.5 inches above and to the inside of the nipple. In other words, it appears to be slightly above the nipple area and then slightly in towards the center of the body. The muscle primarily affected would be the pectoralis major. It pulls the shoulder blade scapula towards the front and down. The nerve innervation is the medial pectoral nerve from the brachial plexus, which contain fibers from the 8th cervical and 1st thoracic nerves. This Dimmack point lies primarily over the superior lobes of the lung. Damage to the lungs is possible with penetrating force. Okay. Point number 16 occurs at 11 p.m. and will result in brain malfunction beginning around 9 months. It is on the left side of the body at a level of about 1 inch below the belly button and approximately 3 inches to the side. This would be approximately in the area where the rectus abdominis muscle meets the external oblique muscle. This junction is known as the linea semilunarius. This area would lie over the lower part of the descending large intestine, colon. This point will lie approximately over the left common iliac artery. The common iliac artery branches into the external and internal iliac arteries. The external iliac artery supplies the lower limb with blood, and the internal iliac artery supplies the viscera of the pelvis. The external iliac artery corresponds to the external iliac vein. Muscular nerves in this area that could be affected would be the ilioguinal nerve and the lateral femoral cutaneous nerve. Lymph nodes that could be affected could be the external iliac nodes, which lie along the external iliac artery and vein. Okay. The next point is point number 17. It occurs at midnight or 12 o'clock. It can result in blurred vision or death. It is on the right side of the body, about 2 inches straight out to the side of the belly button. Blood vessels in this area involve possibly the renal arteries and veins. The suprarenal arteries and veins would be affected with deep penetration of power. The deep lymph nodes and vessels of the thoracic in the abdomen could be affected, primarily those of the common intestinal trunk. The muscle primarily affected would be the rectus abdominis, and as a result of the effects would be much the same as those mentioned previously. Okay. The next point is point number 18. It occurs at 12 noon. The result is death in 20 years. It is to the left side of the back, just above and to the inside of the shoulder blade, approximately to the left of T2 or the second thoracic vertebrae. The deep muscles of this area that could be affected would be the semispinalis cervicalis, the semispinalis capitis, longissimus cervicis, spinalis dorsi, splenius capitis, and splenius cervicis. The superficial muscles that would be affected by a blow to this area would be the rhomboideus muscles and the trapezius muscles. The Trapezius muscle is innervated by the spinal accessory nerve, which is a part of the 11th cranial nerve, and also by branches from the ventral primary divisions of the 3rd and 4th cervical nerves. The trapezius, when all the parts are acting together, rotates the scapula, raising the point of the shoulder and also flexing the arm. The trapezius also draws the shoulder blade or scapula back towards the spinal column. When the lower part of the trapezius acts alone, it draws the shoulder blade down. The upper part of the trapezius will draw the head down on the same side and turn the face towards the opposite side. When the trapezius on both sides of the spine act together, they draw the head directly backwards. The rhomboideus muscles are innervated by the dorsal scapular nerve from the brachial plexus, containing fibers from the 5th cervical nerve. Its action is to draw the shoulder blade in towards the vertebral column, at the same time drawing it slightly upward. The nerves innervating the splenius capitis and splenius cervicis are lateral branches of the middle and lower cervical nerves. The actions of these muscles are to draw the head and neck backwards into the side and to rotate the head and neck, turning the face towards the same side as the muscle. When both sides act together, they extend the head and neck. The nerves innervating the longissimus cervicis are branches of the dorsal primary divisions of the spinal nerves. Its action is to extend the vertebral column and bend it to one side, drawing the ribs downward. The nerves innervating the semispinalis capitis are branches of the dorsal primary divisions of the cervical nerves. Its action is to extend the head and rotate it towards the opposite side. The spinalis is innervated by branches of the dorsal primary divisions of the spinal nerves and extends the vertebral column. A blow in this area could affect nerves exiting from the 1st, 2nd, or 3rd thoracic vertebrae. These are known as spinal nerves. Some of the nerve fibers from this area coalesce in the cardiopulmonary nerve. This nerve innervates, as the name implies, the heart and the lungs. It innervates the heart, the lungs, bronchial tubes, pleura, the chest, and the breast. One of the arteries traveling through this area that would be affected by an injury here would be the descending branch of the transverse cervical artery. The next point is number 19. It occurs at 11 a.m.